Hi, I'm Jan with Valiant Fitness, and the focus of this video is to give some helpful information regarding regular visits to your doctor and or specialist and the need for specific blood lab testing. We believe that it's not enough to go to your doctor once a year and have a basic panel done. We think that it should be more often, at least twice a year. And specifically certain tests that may or may not be normally requested. So we want to point out just some common sense that we think everyone should follow. And in basic terms, if you're unaware of where your levels are at, you may have a condition that you're not aware of. It may not be serious, but it could be the reason why you might feel under the weather, so to speak. Tired, lethargic, you're not able to recuperate very quickly after a workout, and you're not aware of any other, major issues. So it's important to note, find out for yourself of where your levels are at. And what I mean by that is, sometimes very extensive blood profiles can be incredibly helpful. I was part of a research study some years back, actually a couple of them in the last 10 years. This program I was part of had to do with testing for former athletes. Now in this test group, half the test group, as young men in particular, had abused steroids when they were younger. And I was part of the test group that did not abuse anabolic steroids or anything like that as a young person. And this study that was published, research study, I got to know some of the researchers and I kept in touch with them over the years. And they helped me, guide me, help me solve a few issues that I was dealing with. Meaning, I wanted to know what data was out there for certain things. Now, the research group that I was part of with this particular study was over about 3 days where they did complete examination of scans, CAT scans, MRIs, stress tests, besides extensive blood testing. And what I learned from that is a few of my levels were not normal. And I was able to then go to my doctor and, retake those tests and confirm the results and set a path for trying to fix them. But ever since then, I've really been in tune with where my levels are at because, I have a disorder that I have to keep on top of. But at any rate, that was the beauty of this type of research and then having access to people who are looking at data going back, decades. What I learned from one of the researchers is the incredible importance of hormone levels for men or women. Obviously, low testosterone is going to keep a guy from being able to exercise to the extent that they'd like and recovery. If they're too low, you're not going to be able to build muscle and you won't be able to recover. So that's an example of what a low testosterone level may mean. Now, when we get into more specifics, what I believe is important in terms of testing, this is an example of what I've done year to date. And some of it involves CAT scans and MRIs because one particular blood test was an indicator and we needed to follow that, to make sure that there wasn't a mass. And my blood panels are done at least every other month, sometimes every 6 weeks. Now, when we get into specifics about what tests in particular, this is an example of it. So hematocrit is incredibly important, and next to it, I have a description of what that is. Across the top of it are the dates that I had lab tests done. Took out my results here, but what we have is an explanation. Now, hematocrit, and I won't go through every item, but in particular, if you have too many red blood cells, you're in jeopardy of having a stroke. If your blood is thick, too many red blood cells. On the other hand, if it's low and you're anemic, we know what anemia in general means. You simply wouldn't have the energy to even perform the way you'd like, even in your daily tasks. So hemoglobin, which obviously is incredibly important because that carries oxygen to your organs. Those are the type of levels that you got to make sure they're in range. They're where they need to be. Additionally, individual tests for cortisol, testosterone, as I mentioned. Besides these panels, a panel like this, a couple times a year. It's just common sense. And it's going to allow you to get the most out of your fitness program. So whether you're just beginning a program with us in person or remotely with our fitness apps, or you're already in a program and you feel like you're hitting the wall some days where you're not recovering as you might be off in terms of your basic functions here. So additionally, we believe that it's incredibly important to see a cardiologist regularly, especially over the age of 40, I guess, and have a stress test, a full workup to see if your heart rate is where it should be and your rhythms. There's nothing abnormal. They're going to try to push you towards your max heart rate per minute to see if anything is exhibited on the test. Yet again, common sense, incredibly important. And that's the kind of thing that I have done at least every other year, or a full cardiac evaluation. Keep these levels where they need to be. Just have reasonable nutrition and pound the weights or whatever you like to do in an integrated approach, and you'll stay on track. But obviously, without these levels where they need to be, you're not going to get the results that you'd like out of any workout. Thanks for watching.